to the computer. Okay, why have I selected pertussis vaccine is there is something to discuss with it. The main reason is there are two types of pertussis vaccine, acellular pertussis vaccine and whole cell vaccine. And the choice, this is a matter which is intensely debated by the IAP. And I think they give a skewed and biased talk in majority of the IAP meetings. Therefore, you should know what is exactly told by the WHO, what is exactly told by the Indian Academy of Pediatrics, what is the exact evidence that is available in world literature. When you decide, when you see a patient in front of you, should you give a acellular vaccine or a whole cell vaccine? Now, this choice is there only in the private sector, because in the government sector, it is entirely the whole cell vaccine which has been given. And there's no, if you are practicing in a government service, you are not challenged with that. But in private practice, you will find that the people here in our own hospital give the acellular vaccine, which is at least, but very much more costly than the whole cell vaccine. And therefore, is it the right thing? That is something which will come up again and again for discussion. Now we will begin with the MCQs as usual. And okay, can you read it, one of you?
What is the standard primary immunization schedule for DT, WP, DTAP in India as per IAP guideline? Option A, 2, 4, 6 months.
Read it loudly, please. I can't hear you well.
Option B, 6, 10, 14 weeks. Option C, birth, 6 week, 10 week. Option D, 8, 12, 16 week.
What's the answer? Is it so difficult? Lasima, what is it?
6, 10, 14 weeks. Sir.
Yeah, where the answer is straightforward, please answer immediately. We don't waste time on it. This is undergraduate or question. 6, 10, and 14 weeks is the recommended schedule of the WHO and Universal Immunization Program. But you know, in the Western countries, this is something different. Okay. Read it fast, Paris.
Which of the following is absolute contraindication to administering any pertussis containing vaccine? A history of a fever more than 40 degrees Celsius after a previous dose, history of anaphylaxis following a previous dose of pertussis vaccine, family history of seizure, mid-upper respiratory tract infection on day of vaccination.
Quick, yeah.
History of anaphylaxis.
Okay, history of anaphylaxis. These we have discussed 1,000 times. Family history of seizures or history of more than 40 degrees centigrade is a side effect, and the adverse effect is a precaution and not a contraindication. I won't go into that further. Read it.
A 4-month-old infant received his first dose of DTP at 6 weeks and developed a fever of 40.6 degrees Celsius within 24 hours. What is the appropriate management for a second dose? A, contraindicated all features future pertussis vaccine. Administer the next dose as scheduled. This is a precaution, is not a contraindication. Switch to DT vaccine only for all future doses. Delay vaccine until the child is 1 year old. Option B, administer next dose as scheduled.
Okay. Administer next dose schedule. This is a precaution, not a contraindication. Now, Faris, you are reading, I think where are you? You are in ICU or something? Because it's not getting recorded properly. Can Lasima read it next one? Huh? Okay, so it gets recorded better. Go ahead, Lasima. Lasima?
Yes, sir.
Read it, read the question.
According to the IAP, which vaccine type is recommended for use in India's public health program and why? DT,
Quick, give the answer.
DTWP because of its proven efficacy, safety, and cost effectiveness.
Yeah, remember this is not that you read it, but remember this given in the purple book. DTP because of its proven efficacy, safety. Remember the safety. This is given by the IVP purple book, remember, and cost effectiveness. Therefore, this is DTA efficacy. The IAP advisory explicitly supports DTAP. Also endorses for use in resource limited settings. WHO also endorses it. I don't know why resource limited settings, but because of its proven efficacy, safety, and cost effectiveness. What more do you want? He's also talked about safety. Remember this as we go along. Yes, read it.
Which component of the DTP vaccine is primarily responsible for local reactions like pain, swelling, and redness? The aluminum adjuvant.
Well, wholesale pertussis component. The document states most adverse effects are due to diphtheria at a wholesale vaccine. Most adverse effects are due to pertussis component. Okay, that's the reason why they have the vaccine reaction. All right. Therefore, sometimes you may think the question is very simple, but the answer may be a little skewed. Okay.
What is the recommended storage temperature for both DTP and DTaP vaccine? Wholesale pertussis and frozen.
What is it?
A, frozen at minus 20 degrees Celsius. B, room temperature. C, 2 to 8 degrees Celsius, must not be frozen. D, any temperature as long as protected from light.
2 to 8 degrees Celsius.
Okay, 2 to 8 degrees, which is frozen at minus 20. Can you say? It's not available in India. Is the RNA virus COVID vaccine, which is available in the West. And I think -2 to -8 or 10 or something is the polio vaccine, which we keep it in the freezer, the only vaccine. The others are all dead killed vaccine are all 2 to 8 degree centigrade, should not be frozen. Okay. Guidelines: freezing damages the aluminum adjuvant, rendering the vaccine ineffective. Now, let me tell one thing about pertussis vaccine. Among the vaccines, which is DPT, that is diphtheria, pertussis, and tetanus, the least effective is the pertussis because it has got sometimes effectiveness of only 60, 70, 80%. You can very well get a pertussis in a child who's immunized with DPT, but it will be less severe. There's no doubt about it. And at the same time, the most reactogenic is also pertussis vaccine. That you should remember. While if you get a child who's immunized completely, almost impossible to get diphtheria. I've never seen a patient. Tetanus, very, 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 very unlikely if it is well immunized. Pertussis, you can still get. Okay. Can you come up, read it, Lasima?
A 2-year-old child presents for a catch-up vaccination. He has never received any pertussis vaccine. What is the recommended catch-up schedule? A, single dose of Tdap. B, 2 doses 2 months apart. C, 3 doses at 0, 1, and 6 months. D, 3 doses at 0, 4, and 8 weeks. 2-year-old. 3 doses at 0, 1.
Yeah, because the choice looks very simple here. Why not 3 doses at 0, 4, and 8 weeks? Because 0, 1, and 6 months is the best primary immunization you can give. But you don't do it in your regular practice because it's difficult to tell patients we are going to give you at 2 months. 0 means at the first dose. You're going to give you at 6 weeks. You come after 1 month, then come after 6 months. They will forget it. That's why we are giving 0, 6, and 14 weeks. But remember, this catch-up immunization we have discussed in detail is quite variable from vaccine to vaccine, almost kill the vaccine. Definitely DPT, etc. It is 0, 1, and 6 months. This is the best immunological schedule you can have for catch-up. But when you give 2 vaccines like varicella, they're usually given 6 months apart, but they can be given 3 months apart also. I think if I remember rightly, if it is more than 14 years old, you can give the second varicella after 8 weeks. Therefore, human papillomavirus, the second dose should only be given after 6 months. The minimum separation is 5 months. Therefore, each one has a separate this one. But killed vaccine in generally catch-up immunization, the best regime is 0, 1, and 6 months. Okay. That we have read. This is a standard catch-up schedule for children, in unvaccinated patient. Okay, this is the next question.
Which
Yeah. I can't hear. Hello?
Which of the following serious adverse event has been conclusively proven not to be causally associated with the wholesale pertussis vaccine? A. Hypertonic hyperresponsive episode. B. Encephalopathy within 7 days. C. Autism. D. Seizure within 72 hours. Not associated is autism.
Yeah, it is that autism. You know this. Now let's come to it. The document explicitly states it has now been beyond doubt that wholesale vaccine is not causally associated with autism. Hypertonic hyperresponsive episode and seizures are rare but known adverse. Encephalopathy is a contraindication. Here there is a problem. They have clearly stated that wholesale vaccine and this is acellular vaccine are not associated with encephalitis clearly. But encephalopathy within 7 days is supposed to be is a contraindication. That is, if you give an hepatitis viral vaccine, if you give a DPT today, he comes within 7 days with encephalopathy, you will immediately, it will be a contraindication for further vaccine. Though they say that pertussis vaccine never causes encephalitis. Anyway, now, how do you differentiate? Now the child, you see, you gave pertussis vaccine today, Lazima. 3 days later, he comes with a convulsion. How do you know whether it is a febrile convulsion or a encephalopathy? Can you, hello, Lazima, you can hear me?
Sir,
Gopika, can you answer? Gopika, you're there?
yes, sir.
Yeah, tell me what's the answer. How do you differentiate a child who comes to you with seizure, say on the 3rd day after your vaccination? And how do you know whether it's a febrile convulsion or an encephalopathy? Is it so difficult?
There will be
What's it? Yeah,
sensorium.
yeah. Usually in febrile seizures, once the seizures develops, and within half an hour, the sensorium will come back to normal. But that doesn't mean that you can't have a status epilepticus after febrile seizures. They say the commonest cause in the children with status epilepsy is febrile status. But anyway, you will have to differentiate between an encephalopathy and if there is an altered sensorium in between the seizures, then you would suspected to be an encephalopathy. Encephalon means brain. Encephalopathy means when the brain doesn't show any pathology, but the pathology is outside, but the clinical presentation is like an encephalitis with fever, seizures, and also altered sensorium. Now, you might do lumbar puncture, everything, and when you send the patient home, you think it is a febrile seizure, you can definitely give. If it is an encephalopathy, then you cannot give. It's a contraindication. Then the question rises, how can DPT does not produce encephalopathy? Then how do you become an encephalopathy? But that's the present science. Encephalopathy within 7 days, it is definitely a contraindication. Though they say both acellular and wholesale vaccine does not cause encephalitis. That will come on later on. And when I asked you a question, the patient came with convulsion on the 3rd day. You should have said it is more in favor of encephalopathy because the febrile seizures occurs usually within the first 24 hours. All right. Any seizure within 24 hours, 72 hours is not a contraindication because it can be febrile seizures. Okay. So here is a, can you read what is given inside the adverse effect? Yeah. Read, Lasima, or anybody.
Minor adverse effects such as pain, swelling, and redness at the local site, fever, fussiness, anorexia, and vomiting are reported in almost half the vaccines after any of the 3 primary doses. Serious adverse effects have been reported with the wholesale pertussis vaccine but are rare. The frequency of the side effects 1,000 doses is 0.2 to 4.4 for fever, more than 40.45 degrees Celsius, 4 to 8.8 for persistent crying, and 0.06 to 0.8 for hypertonic hyperresponsive episodes, 0.16 to 0.39 for seizures, and 0.007 for encephalopathy. The frequency of systemic reaction reduces and that of local reaction increases with increasing number of doses. Serious adverse effects such as sudden infant death syndrome, autism, chronic neurological damage, infantile spasm, learning disorders, and Gray syndrome were attributed to the use of the wholesale pertussis vaccine in the past. It has now been proven beyond doubt that the wholesale pertussis vaccine is not causally associated with any of these adverse events.
Now you must read this very carefully that even some of our neurologists would say that it does produce infantile spasm, chronic neurological damage. No, it has been proved beyond doubt. That's what the purple book says. And it's given all CDC everywhere that these are not related. But you must remember that these are common, HHG, seizures. Encephalopathy also is given here. In the IAP book, 0.007 is given encephalopathy. That's why, but later on, I think they contradict this statement. In purple book, they give contradictory statement, different pages. We will come to that. But remember, all these are very important for you to know. That here may read in between line, local fussiness, vomiting, a report almost half the vaccine after any 3 primary series. What they mean is whether it's AP vaccine or WP vaccine. Remember, that's given in one page of this. And some people will come and say, Doctor, I'm worried the previous child is having infantile spasm. No, but if they are really worried, you can give the AP vaccine, but there's no evidence of it. Now, okay, read it now. Can you read? It's taking time.
A 7-year-old child with an incomplete primary series, only 2 doses of DTWP at 6 and 10 weeks, presents for vaccination. Which vaccine should be administered?
Quick. Is it so difficult? We are at the end of the immunization classes, Majida, you want to answer? Majida is there. Majida?
Yes, sir.
Yeah. What's the answer?
Acellular pertussis.
Okay. DTAP. What do you say, Gopika? Gopika, you are there?
7-year-old
Yeah. Okay, I'm a little shocked. You understand, after so many classes, this is a very vital question. See, above 7 years, you don't go DTAP. Even the D here, D is not allowed. You understand? After 7 years, you can either give TDAP or TD. If TDAP is not available, you will give TD. T is capital. Full dose T can be given. D should be low. Remember, I'm a little surprised that you didn't answer this. Is Rose on the line? No. Rose is there? No. Huh? Okay. Now, Rafa, read it now. What's the answer? You're wasting time. Yeah.
DTWP or DTAP are not recommended for children 7 years and older due to increased reactogenicity. Tdap is the correct vaccine for catch-up in this age group.
Now, in the government sector, if you don't have TDAP, you will have to give TD. Remember this. Now, Majida, you read it now.
What is the preferred site
Yeah.
for administering the 0.5 ml dose of DTWP and DTAP in a 3-month-old infant?
Straight. This is a straight answer. There's nothing great in it.
Anterolateral aspect.
Yeah, anterolateral aspect of the thigh. Previously, we used to give it in the gluteal region, and we used to have a lot of sciatic nerve paralysis. Now it's given in the anterolateral aspect of the thigh only. And about 2 years, you can give, I think, in the deltoid. That's the cutoff region. Okay. And yes, Majida, answer it. Read it.
A 5-year-old child received his last DTWP booster at 18 months of age. Is a second booster at 5 years necessary?
Is it? I thought I will delete these questions because these are very straightforward questions. But I thought let it be there. I was wondering whether I'll be wasting my time not discussing the core issues on which I wanted to test you. Anyway, Gopika, can you answer? You're going for the exam. Do you need to give the booster at 5 years? Are we giving it? Second booster at 5 years, are we giving it in universal immunization?
Yes, sir.
Yes,
Yes, sir.
definitely.
Yes,
You
sir.
see, the answer
Yes,
is
sir,
given
yes.
is now the answer is yes, always is you have to give it. But the second one is also right. No, if the last dose was given after the age, actually, that is not the right answer. It should be yes, always. Definitely, if the last dose was given after 4 years, you need not give the booster at 5 years. But as I written, A is also correct. In MCQ, sometimes even from very important textbooks, if you take it, sometimes the answers can be ambiguous. Definitely a 5-year-old child who has taken the 2, 4, and 6 months and second booster, you should give it 5 years. Otherwise, why are we giving it union immunization dose? But if you miss it, yeah, but there is problem that there is waning of immunity. Remember, but definitely the second booster is not required if the last dose has been given beyond the age of 4 years. Okay. Now here, remember, DTWP is not recommended in children 7 years and older due to decreased reactivity. D is also not allowed, not only the whole cell vaccine. Now come. Majida, read it now.
Which statement best describes the efficacy of acellular pertussis vaccines compared to high efficacy whole cell vaccine?
Yes.
Acellular pertussis vaccines are consistently more efficacious. B. Acellular pertussis vaccines are equally efficacious in all settings. High efficacy whole cell pertussis vaccines may be more efficacious than acellular. Acellular vaccines have no proven efficacy against severe disease.
Now, this is a statement which is written. If you read very carefully my presentation, it was there. Therefore, but the answer, which one do you think is right? Gopika, you want to answer?
High efficacy for vaccines may be.
Yeah, see, this is a very loaded statement that is given in CDC. That is IAP document site study showing that at least 5 trials found that WP vaccine is greater efficacy than APC. CDC also acknowledges the waning immunity of AP vaccine. But here, high efficacy. See, what they say is the efficacy of WP vaccine. We will read the next one and then go about discussing it. Majida, read the whole thing.
Recent outbreaks of pertussis and choice of whole cell pertussis versus acellular pertussis vaccine.
Several randomized trials conducted in the 1990s to document the efficacy of acellular pertussis vaccines also compared their efficacy with whole cell pertussis vaccine. Studies to date indicate that acellular pertussis vaccines are more effective than low efficacy whole cell pertussis vaccine, but may be less effective than the highest efficacy whole cell pertussis vaccine. At least 5 trials found that whole cell pertussis vaccine had greater efficacy than acellular pertussis vaccine. Many later trials have also hinted that the efficacy of the acellular pertussis vaccine may not be as robust as studies after the outbreaks in the US reported in the initial studies. UK and Australia have now concluded that the change from whole cell pertussis to acellular pertussis vaccine contributed to the increase in pertussis cases. These findings suggest that priming with whole cell pertussis is more effective at sustained prevention of pertussis disease than acellular pertussis vaccine. Witt and colleagues, after reviewing data from the Kaiser Permanente, North California, concluded that a wholly acellular pertussis vaccine.
Oh, I don't know. There something is missing in that. I'm sorry about it. This is slide number 17. Okay. These are taken from the IAP book. Okay, the last sentence is taken from some other study. It will come up again. The reason why I put up between whole cell vaccine and cellular vaccine is a core issue where we have, because in discussions in IAP, the multiple times they discuss all this, and it is quite variable. And IAP Purple Book itself, as we go along, they will say one thing in one page, the opposite in the other page. What you and I are interested in, which vaccine should be given in private practice. That's the most important thing. But remember, there are certain statements maybe here. See, the whole cell vaccine, its efficacy varies from lot to lot. There's a problem in that. By high efficacy, whole cell vaccine are more effective than the acellular vaccine. But there are some low effective whole cell vaccine, which may be less effective than acellular vaccine. This is a statement that is made, but that is not the important point. The whole thing, the most important thing is this, which is a comparative evaluation of the whole cell vaccine and acellular vaccine. Now, this table is there in the IAP2, the purple book, as well as in the pink book, which came earlier. Very, very important, because in the table, they are given so much information, and you should know it very clearly. The first three are not repeated. I have highlighted some of these things in the subsequent presentation. Now, these are not highlighted. The animal model for potency in WP vaccine is known. It's not known here. Correlate of protection are not there. That is antibody level. You cannot have a correlate of protection like tetanus or hepatitis B, an antibody level for pertussis vaccine. That's the main problem of comparing whole cell vaccine and acellular vaccine. The antibody levels are not correlate of protection. And this is, of course, there. Now we will come back. We are looking at the efficacy. Now I have highlighted it here. And remember, this is the purple book of 2022. And the IAP book have given the same thing of comparative. I've highlighted something. Now, if you look at the effectiveness, now effect means what produces a higher antibody level in the experimental condition. Effectiveness means how it decreases the disease in real situation. And impact means what it has on the overall health of the children. Now here, if you look at effectiveness, that is how it decreases the disease. Whole cell vaccine is established. It's written by the Indian Academy. AP vaccine, there is no data in India. And they say the priming, we will come to that again and again, this priming and all will come. Duration of protection is longer for whole cell vaccine, is shorter for these vaccines. Given in black and white or clean black and white, but I made it into green and red. That is given very clearly. Have it in your, if anybody comes and says, no, AP vaccine is equally effective, that is why we are giving in PRS hospitals. No, that is a wrong thing, because it's given clearly in our IAP purple book and also WHO everywhere. Effectiveness established, duration of protection high. Now let's come to the next one. we will just read this now. The resurgence was seen only in 5 countries for using AP vaccine and 1 using WP vaccine. That is the thing. Now, if you look at here also, if you look at efficacy, they say variable data, efficacy and effectiveness have been compared. Efficacy, wholesale vaccine, variable data, global. There is robust data globally for AP vaccine. For wholesale vaccine, there is no trial in India. There's no trial in India. But for effectiveness, that is how it has decreased the disease. Whatever you might say, wholesale vaccine may vary from one to the other. Therefore, you cannot, there's no correlate of protectivity. It is effectiveness is established in India. It's established. Remember this. No data is available as far as AP vaccine is concerned because it is not proved. It is given only in private sector, and there are no well-controlled studies, while effectiveness is established. Now, remember here, effectiveness globally, it is well established all over the world, wherever they are giving wholesale vaccine, Africa, everywhere is. But AP vaccine, where they are giving in countries like America, Australia, there's a resurgence of pertussis. There is an epidemic of pertussis occurring in children who are fully immunized. That's a problem. Remember, go through this again and again when there's a controversy. Now, go ahead and read this, Majida. Quick.
A child with a stable, non-progressive seizure disorder, example well-controlled epilepsy, is due for vaccination. Can DT wholesale pertussis be administered? No.
Yes, sir. It's B.
Gopiga, what's the answer?
B.
B.
B. Yeah, SDTWP can be safely given to children with neurological disorders. Read the answer. Okay. Read the answer, Majida.
Yes, DTWP can be safely given to children with stable neurologic disorders.
This is very important because cerebral palsy maybe you will get in the long case, like, a neurological case, most likely case you will get in your exam in neurological case. One common question with the examiner would ask you, what about the immunization of this child? Or what about cerebral palsy? What will you say, Majida? Will you give or not give? A child with a cerebral palsy, will you give or not give?
We can give, sir.
Yeah, it is a non-progressive disorder. It's one of the definitions of these. The lesion is non-progressive, but the symptoms may keep varying. You may get seizures more and more, but it's a non-progressive illness, and therefore you should say that after proper counseling, I will give, because it is a non-progressive neurological center. In evolving neurological illness, it may be a problem. Now remember, read what is given in the bracket, please, Majid. See, this slide, I send it to you for your reading, and then I am asking the questions. Okay.
Progressive or evolving neurological illness are a relative contraindication to first dose of DTWP immunization. However, DTWP can be safely given to children with stable neurologic disorders.
Therefore, in this particular case, they said epilepsy well controlled. Therefore, it is stable. If he is not getting control, probably it is evolving. You may not give it. You may delay it. Okay, that is the thing. And now, if you look at this, see, serious adverse effects are rare. I don't know why I put it up again. Herd effect. Remember that herd effect is present in WP vaccine, and there's no herd effect in AP vaccine. We'll come to that later. Anyway, I don't know why this came up again. 1 minute, what was the slide number? 24. Probably I have removed it. Okay. Okay. Read the question.
According to recent immunological studies cited in the IAP document, which type of T helper cell response is primarily induced by wholesale pertussis vaccine? Th2 skewed response, Th1 and 17 skewed response, T regulatory response, Th9 skewed response, Th2 skewed response.
Who, Majida, you just come in. Yeah. You just got married, therefore you are allowed this answer. Gopika, what's the answer? Gopika, you are there or Lasima, would you like to answer? Faris, anybody?
Sir, Th1 and 17 skewed response.
Yeah, okay.
Sir,
Finally.
TH2.
Okay. Okay, read it now. Read it now.
Answer B, Th1 and Th17 skewed response. Document states whole cell pertussis containing vaccines elicit Th1 and Th17 skewed response, whereas an AP containing vaccine induces Th2 skewed response. This is thought to contribute to longer lasting immunity.
Okay, now not only it is just studies, basic immunology has shown that the whole cell vaccine is superior. Basic immunology has shown. Now, what is that basic immunology? Read it very carefully. Majda, read it.
CD4 T cells play a critical role in mediating adaptive immunity to a variety of pathogens or antigens. Naive CD4 T cells may differentiate into one of several lineages of T helper cells, including Th1, 2, and 17, and induced regulatory T cell, as defined by the pattern of cytokine production and function. Th1 cell produces interleukin 2 and interferon gamma and are involved with intracellular organisms such as mycobacteria and induce T cell response. Th2 induces interleukin 4, 5, and 13 cytokine induced humoral response against extracellular organisms. Th17 plays a crucial role at mucosal and epithelial surfaces. All cell pertussis containing DPT, diphtheria, pertussis, and tetanus vaccines elicit Th1 and 17 skewed response, whereas an acellular pertussis containing vaccine induces Th2 skewed response. Regulatory cells are essential to the balance between pro and anti-inflammatory response.
The very fundamental thing which they have written in very clearly that Th1 cells produce intel. That is what is Th1 and 17 are what is produced by the whole cell vaccine. Interferon gamma involved with intracellular organisms such as mycobacteria and induced T cell response. Remember this. They a very good T cell response it induces. Th2 induces humoral response against extracellular organism. Therefore, Th17 plays a crucial role at mucosal. Therefore, that is why, because Th1, it induces T cell response, intracellular organism, interleukin, great. Th17, it induces mucosal and epithelial surface. Therefore, the organism cannot remain in your nasal mucosa. Therefore, there is a herd effect. Remember this. Everything is well explained. There is no doubt about it. Whole cell vaccine, therefore, Th2 is by AP. Therefore, when is AP Th2 against extracellular organism only attacks. Therefore, psychologically, this has been shown, and this has been published even not only by the Indian Academy of Pediatrics. It has come about in WHO position paper, and even by the position paper of the Indian Academy of Pediatrics. You can read it. What is it? Majida, read it.
A baboon model of pertussis suggests faster waning of protection with AP primary series and limited impact on infection and transmission. The model suggests that both Th1 and Th17 memory responses are needed to produce sterilizing mucosal immunity. In baboons, the AP vaccines induces higher Th2 but lower Th1 and Th17 responses and are less effective in clearing the pertussis organisms and preventing transmission.
Remember, these are all given by the Indian Academy of Pediatrics pertussis vaccine. When you go into IAP websites, webinars, they contradict all this. How they dare they do it, I don't understand. Anyway, this is clearly given that the basic immunology is different. You have to read the whole thing also, this one.
Original WP and AP priming generates comparable protective immunity in the first few years after vaccination. However, WP and or AP priming induces different T cell phenotypes which have been shown to persist for at least 15 years. Adults who received a Tdap booster and who had received either WP or AP priming followed by multiple AP boosters, the AP primed group showed increased interleukin 4, IL-5, IL-13, and IL-9, and transforming growth factor beta, TGF-beta, Th2 responses, and decreased interferon gamma and IL-17 production, Th1 and Th17 response. Defective in their ex vivo capacity to expand memory cells and less capable of proliferating in vitro. Pertussis-specific IgG4 antibodies were significantly elevated in AP compared with WP individuals. 24 to 31
That's a mistake. Okay, yeah. Yeah, go ahead.
while IgG1 antibodies are potent neutralizing antibodies, IgG4 antibodies are less effective in neutralization and are more tolerizing in nature.
Okay, the only thing that is given here is that this is priming, you understand. Here, priming induces different T cell response. And they say who received Tdap booster and who had received WP or AP priming from multiple AP boosters, the AP primed individual showed if the first dose is AP, then the memory B cells don't get stimulated as well as the others. Okay, that's what they have written here. Read this: adults who received Tdap vaccine who had received either WP or AP priming, followed by multiple booster doses. The AP prime group showed increased interleukin. This may look confusing. Defective in the ex vivo to expand memory cells. Therefore, they're long lasting. It has also been now explained why there is waning of the immunity. We'll come back to that later. Okay. Can you read it?
Which of the following is the key reason cited for the resurgence of pertussis in some countries with high vaccination coverage?
Okay.
Emergencies of a new vaccine-resistant strains.
Following research
Pertussis.
pertussis in some countries with a high vaccination coverage. Faris, can you answer?
Waning of protective immunity.
Waning of protective immunity.
Waning of protective immunity over time. Who answered? Who said this? Lazina? Okay. Now we will come to the answer. Is Ashwati there or she's on leave today also?
Duty answer.
Okay. Nara duty.
ERPGM Ashwati.
Okay. Okay. Now read the answer. Vachal. You can't
Waning
see.
of protective immunity over time. Both the IAP document and the cited meta-analysis state that protection wanes over 4 to 12 years of both WP and acellular pertussis vaccines, with more rapid waning noted for acellular.
Okay. You can read it. You can read what's given in this, the IAP book. Okay.
Recent outbreaks of pertussis and choice of wholesale pertussis versus acellular pertussis vaccines. Since 2009, large outbreaks of pertussis are regularly reported from many countries such as USA, UK, Australia, Chile, Brazil, Colombia, and Pakistan, employing both AP and WP vaccines despite having very high vaccination coverage. Reasons for the resurgence of pertussis were found to be complex and varied by country. Waning of the protective immunity is noted with both WP and AP vaccine and also after acquisition of immunity after natural infection.
Okay. Okay. Now, see, the point is there is a one slide which is missing here. In fact, the pediatrics, which is the official journal of the American Academy of Pediatrics, has categorically said that there are multiple reasons why there is resurgence of pertussis in America. There was a big California epidemic in which many children died. They say there may be multiple factors for the resurgence. The most important thing is a short waning immunity for AP vaccines. Therefore, that has been given very clear significance. Now, you cannot say any other reason, but that is not caught up in the slide here. Complex and varied waning of protective immunity is noted in both AP and vaccine, but also attacks natural infection. But actually, the pediatric journal says that AP vaccine waning is the most important reason. Now, read. Well, see, the Indian Academy of Pediatrics recommendation pertussis vaccination and public health perspective. Read what is given.
The Advisory Committee on Vaccines and Immunization Practices of the Indian
1 minute. Okay, read it. Yeah, Advisory Committee, read it.
Of the IAP unambiguously supports the current immunization policy of employing only WP vaccine in the form of DTWP in UIP because of its proven efficacy, safety, adequate public acceptance, and absence of documentation of significant waning. There is insufficient marginal benefit to consider changing from a WP containing vaccine to AP containing vaccine.
What have they written here? Absence of documentation of significant waning, AP vaccine. This is IAP book. And what have they written a few pages before? Found to be complex and varied. Waning of is noted in both WP and AP vaccine. This is the problem with the immunization book of Purple Book. You understand? They will contradict the same thing, or they don't read what is given before. It's not that the right hand doesn't know what the left hand does. The left hand doesn't know what the left hand does, and the right hand doesn't know what the right hand hears. See, the IAP book on one guideline they have given like this in one page, and in the public health perspective, they are written in absence of documentation of significant waning for DTWP vaccine. So this is a problem, and when you choose, see, you must remember this Purple Book is handled by is the most important flagship bearing book of the Indian Academy of Pediatrics, because they are supposed to be the final authority on talking on immunization, and more than 40 to 50,000 consultant pediatrician consider it as their Bible or Quran or Bhagavad Gita and read it. They're supposed to be reading it, but I find them they are not reading it. That's a different matter. But when you read it and when you really analyze it, it looks very disturbing. And even if you write to them, such mistakes are there, they don't even respond. They don't bother. But remember that one place they have definitely written that there is no waning of immunity for whole cell vaccine. At the same time, they have also written that the resurgence is noted with both and also after acquisition immunity, with the waning of immunity noted with both they have written. But the fact of the matter is there is definitely more waning with the AP vaccine. And we have written, and what is the reason why they say the immunological basis of which we have already said, the immunological basis of which we have already said. But look at the other reasons why we say that there is waning of immunity. Can you read it, Majida? Whole thing, fast.
The factors that have probably contributed to the increasing numbers of recorded cases include higher disease awareness, improved surveillance sensitivity, and enhanced diagnostic sensitivity of the now widely used PCR. WHO analyzed the epidemiology data from 19 countries with high vaccine coverage with history of good disease control. True resurgence was seen only in 5 countries, 4 using AP vaccine and 1 using WP vaccine. In Australia, the 18th month booster dose of DTAP was dropped in 2003, which was followed by resurgence in 2008 to 2012. In Portugal, 6 years after AP introduction, there was an increased incidence in infants less than 1 year, suggesting true resurgence, though changes potentially magnified by increased PCR testing. In England and Wales, the increased incidence was noted in infants less than 3 months, too young to be vaccinated. Data from the US suggests waning of immunity following AP vaccine.
Okay, therefore, what they say is the most important true surgeons, 5 countries, only one was using 6 countries, only one was using WP vaccine. Okay, there is a concern, therefore, definitely waning of immunity, long lasting, preventing resurgence, definitely whole cell vaccine is better. Now, this may be, you might say that these are all later ones, but 2021, a systemic review of the literature was done by Wilkinson, published in the Vaccine. You can read the whole thing, okay? Can you read?
So, we conducted a systemic review of the duration of protection.
Majida, read loudly, please.
Conducted a formal meta-analysis using random effects models. Evidence continues to suggest that receipt of any pertussis vaccine confers protection in the short term against disease, although this protection wanes rapidly for acellular pertussis vaccine. This is a first systemic review and meta-analysis to explore the impact of multiple sources of heterogeneity on pertussis. We estimate
Vaccine effectiveness.
Vaccine effectiveness estimates through extensive subgroup analysis. Even with high heterogeneity, the findings from our analysis were consistent with those from previous SRMA showing high protection following any pertussis vaccine with declining acellular pertussis vaccine effect over time.
Therefore, even the most recent systemic analysis and meta-analysis published in the reputed vaccine series 2021. See, in immunology, it doesn't change every day, vaccination. It clearly says that protection in both of them produce short term, up to 5-10 years, it may both of them hit. But after that, there's a significant waning of immunity with the acellular vaccine. And that is very important. Again, I remind you, duration of protection is longer for whole cell, shorter for AP vaccine, given in black and white or green and red in the IAP immunization book, reiterated in 2022. Remember, they said this in 2018. They are priming. You know what is priming? It's superior for whole cell vaccine and inferior for this vaccine. Effectiveness, all we have said. Okay. Majida, what is priming? Can you tell me what is priming? Somebody asks you, can you tell me what is priming? Paris, can you help? Gopika, can you answer that? Nobody wants to answer. What is priming? I just said that. Here is written whole cell vaccine priming is superior. What do you mean by that? Well,
Just
yeah. Come on, fast.
Exposure to antigen.
Well, I just said about 5 minutes ago, priming means if you give the first dose with what you give, it stimulates the memory cells also, so that the subsequent doses will produce long-lasting immunity. Children who are given WP vaccine as a first dose, subsequently given AP vaccine, had a longer lasting immunity. But children who are given AP vaccine as a first dose, subsequently given any type of vaccine, the immunity did not last that. Therefore, priming means it converts, you see, the initial dose which you give not only produces antibodies, it also produces memory cells. And memory cells are produced very well by the whole cell vaccine and not by the, therefore the first dose basically should be it is better to be a whole cell vaccine. This is one of the reasons we give OPV also. OPV also is supposed to prime the vaccination polio. But remember one thing, that the IAP purple book, now it is good. It contradicts here and there and makes the whole thing very difficult. Now remember, read what is given here. You will be shocked to read it. Can you read it, Majida?
The reasons for the resurgence of pertussis in a number of countries were found to be complex and varied by country. The shorter duration of protection and probable lower impact of acellular pertussis vaccine on infection and transmission are likely to play critical roles. Many studies in industrialized world documented faster waning with acellular pertussis vaccines and showed that protection waned after 4 to 12 years. The book erroneously contradicts its own above statement. The efficacy and duration of protection with diphtheria, tetanus, and acellular pertussis vaccines against diphtheria or tetanus and pertussis is similar to that afforded by the wholesale vaccine.
Now, remember this, what they have written here, shorter due probable lower infection transfer likely play critical roles. That is the reason. Resurgent and pertussis, they say it can be complex. It can be why? Because nowadays we do more tests. Even mild cough, you might do a PCR and detect it to be. That's why one of the reasons. And more awareness, more surveillance. These are it. But even in Western countries, they say this critical state come in the pediatrics also. I forgot to put it up in this one. Therefore, that's one they have written. Now, see what this is given in old 141, and they have copied and pasted it in the purple book in page 167. Now, the old 138, it contradicts this. It same is similar. See, it says duration of protection are similar. And now, if they had understood they have made a mistake, they have repeated it again in the purple book. But whatever it is, you should carry home international publications, IAP publications, now it is WHO publications clearly states wholesale vaccine waning of immunity is less than in acellular vaccine. Now, if you want to know from WHO directly, they say here a shift in distribution towards the older age group has been reported in some high-income countries, particularly where AP vaccines have replaced WP vaccine for primary series. The shift may be increased recognition and surveillance, more sensitive laboratory testing, waning of vaccine-derived protection, and reduced boosting immunity by circulating pertussis. Therefore, there is a waning of immunity. Is it of concern? What is of concern of shift in the wholesale pertussis to older children, older adolescents? Because if it circulates in adolescents, mothers may get infected and you may get neonatal pertussis. Therefore, there is a concern, there's a fact, but one of the main reasons is waning of immunity. Okay, now read it.
The private sector in India, the IAP recommends that if a parent is concerned about reactogenicity, which vaccine can be used for the primary series? A, only wholesale pertussis should be used. DT, diphtheria tetanus vaccine is preferable. Acellular pertussis vaccine can be administered to address parental concerns. D, vaccination should be deferred until the child is older.
Okay, answer it. What do you think? Paris, while you give answer.
Wholesale pertussis.
Only DTP should be used, but that's what I would say. But parents are concerned. You go by the parents' response. But you know what is written here? You will be surprised. Okay, read it.
Acellular pertussis vaccine can be administered to address parental concerns. The IAP states, in view of parental anxiety and concerns for its reactogenicity, acellular pertussis vaccine can also be administered in the primary series. The primary goal is to increase the coverage.
Now, this is something which is very, very ambiguous answer to give. I would come to that as we go along. I would not agree with it. You will have to counsel the parents. And if they still say that we are worried, of course, you will have to take the opinion of you'll have to go with the welfare of it. But remember, see, after having given so many advantages of the vaccine, now they are coming out and telling that the primary immunization, individual use IAP recommendation, okay, should be complete with 3 doses of either wholesale or AP vaccine, irrespective of the number of components. The schedule should begin at 6 weeks of age with 3 doses administered in interval of 4 weeks. Now they go on to say that WP vaccine is definitely superior to AP vaccine in terms of efficacy and duration of protection, but more reactogenic. Okay, note every sentence that they're telling. Okay, now in view of the parental anxiety and concerns of reactogenicity, AP vaccine can also be administered in the primary series. Okay, now they are selling that just because there's reactogenicity. We will come to that whether it is a true statement. Therefore, now they say that because reactogenicity is there, both of the vaccines, giving so much, but at the same time, they say WP vaccine is definitely superior to AP vaccine in terms of efficacy and duration of protection. What is counseling? Counseling, you place the facts in front of the parents. You must definitely say that WP vaccine is superior and longer acting, both in efficacy. It stresses efficacy also, and also, but slightly higher. What is this reactogenicity? That's what we are now. This is where the reactogenicity comes in. Now, I would say, if you look at the minor adverse effect and serious adverse effect, they say 1 episode in 2 to 10 injections equal to control. Therefore, definitely AP vaccines, minor adverse effects are less. There's no doubt about it. But what are the minor side effects? Fever, crying for more than 3 hours, and convulsions all become serious side effect. And therefore, the minor side effects alone are more probably, even that is only 1 episode in 2 to 10 injections. Here is equal to control. Serious side effects, very rare at par with WP vaccine. It is equal to WP vaccine. Remember this. Therefore, the thing is that as far as that, if you are asked what about the adverse events, you say the minor adverse events are equal, definitely more in for the parents, for more in wholesale vaccine. But what is minor? I have to agree to that. What is minor for a doctor? It is not minor for the mother. For example, if you have temperature more than 40.5, they are considered serious. Insoluble crying for more than 3 hours, not sleeping the whole night, etc., or a febrile seizure, may be minor for a dog as far as medicine is concerned. But for the mother, it may be worried. But then, what is the reaction in India? See, in the acceptance in the wholesale vaccine in the whole world is poor. You understand? I don't know what happened. Why? Suddenly the marker went. Yeah, is poor in global circumstance when AP vaccines are accepted better all over the world. But in India, there is no documented risk. This is what I have found even in PRS hospital. I used to give wholesale vaccine, and when they come for the second dose, I used to ask them, is there any side? Hey, how was the child after the first dose? They said nothing. And then when I said, did he cry? Yeah. For 1 week, he was little jittery. He was not normal. He didn't sleep on the first day. But these things, they accept it. Remember, therefore, it is therefore, this to make the statement that if it is reactogenicities, they are overplaying it and probably playing to help the acellular vaccine, which are definitely more costly. Okay, now we have gone through this. Go to the next question.
For a booster dose in an 18-month-old child,
Majida, you didn't have breakfast, I think. You didn't have lunch, I think. Dinner. Your voice is not heard well. Can you?
For a booster dose in an 18-month-old child who received TT wholesale pertussis vaccine for the primary series, the IEP suggests which of the following if resource permit. Another dose of the wholesale pertussis vaccine is mandatory. Can be acellular pertussis vaccines can be considered for the booster due to lower reactogenicity. Tdap should be given. No booster is needed at this age. Another dose of
Yeah, that is what is the right answer, but this IAP has made some funny statement. If you look at it, DTP can be considered boosters lower reactive. From where they arrived at this, I don't know. I am presenting this to show you that this document, the Purple Book, is a biased statement. Biased, I'm sure they are under the hold of the AP vaccine. You look at what they have written. The document states, consider the higher reactogenicity of the AP vaccine or AP vaccine combination can be higher reactive. AP vaccine or AP vaccine can be considered for boosters if resources permit. Okay. The document itself is the source of the specific statement, but questions are source in its present IAP. I'll come to that later. Therefore, where does it state that? What does it say? For booster doses, it are telling give AP vaccine. From where it came, I don't know. It's the individual use. However, considering the reactogenicity of AP vaccine combination be considered for boosters if resources permitted. From where they got it is very difficult to understand. Now read it. Minor adverse effects such as pain, swelling, redness, fever are reported in almost half the cases after any of the 3 primary doses. Now they say that minor side effects are more common with wholesale vaccine. Here they contradict and say any of the 3 primary doses. I mean, one, first, second, or third, that might be. The frequency of systemic reaction reduces and that of local reaction increases with increasing number of doses. It is only the local reaction that increases. The systemic reaction reduces. Now look at our question here. The 80 Urusi DT for the primary series. Definitely he had no side effect. Can be, why should you consider a booster? Because in booster, why should you consider acellular vaccine? If at all, he will have a increase in the local side effects like pain, swelling, or slight pain, fever. Systemic side effects do not become less as you give more. Therefore, many of the statements which they are made in the purple book are contradictory and is not based on evidence. Now look at the basic science efficacy. But sometimes you will find that even the WHO makes contradictory statement. Now this is an information sheet, observed rate of vaccine reaction and diphtheria in May 2022 by WHO. And what have they said? For primary immunization for mild events, as of mild events, severe adverse events occurring with DTP are similar in nature to those that occur with DTP, but occur less frequently. Seizures, persistent, and fever have all been reported. Therefore, they say for mild as well as severe, the DTP vaccine, the DTAP are similar in nature to those that but occur. All the side effects can occur, but less frequently. That's not what is given in the book. Now, but you remember the reports in standard books and journals, serious side effects are at par. There's no association between pertussis. Therefore, even the flip-flop is very well noted in the purple book. WHO also makes here and there some statement. But if you want to know the exactly from the WHO, the frequency of adverse events following API vaccination does not differ from the observed in plasma group. However, after primary series, reaction tend to increase with each successive DTAP booster. Therefore, it is difficult to understand why in booster you want to give DTAP vaccine, how they made the decision. Now, you read this. Read this. Can you read it? Yeah.
Adverse effects.
Yeah.
The acellular pertussis vaccine score over the wholesale vaccine in terms of adverse effects. Broadly speaking, the incidence of both minor and major adverse effects is reduced by 2/3 of the acellular vaccine. The incidence of adverse effect is similar for all currently licensed acellular pertussis vaccine. The absolute contraindications to acellular pertussis vaccines are the same as those for wholesale vaccine and include a history of anaphylaxis or encephalopathy following past pertussis vaccination. Serious adverse events following previous pertussis vaccination listed in wholesale pertussis section, though less likely as compared to wholesale pertussis, may still occur with DTaP and are similarly considered as precocious while using the vaccine.
Okay.
After the primary
Yeah. Go ahead. Yeah.
series, the rate and severity of local reactions tend to increase with each successive DTaP dose.
All right. Therefore, what you understand in this particular slide, they are made 4 or 5. Many of them are, they say DTAP vaccine score over the wholesale with adverse events. A broad statement. Broadly speaking, both minor and major side effect is reduced by 2/3 with the acellular vaccine. This is not what is given. This is not what is given in the table of the same book itself. Therefore, the absolute contraindication is same, and therefore these statement which they have made, I look very carefully to look for the reference, and the purple book does not give any reference. Where did they say that it is reduced by 2/3 if you give major side effect also? Reduced by 2/3 by acellular vaccine is very difficult to solve, because we have seen that wholesale. We will see how I'll show the slide again where they say that it is same. Severe side effect are the same in both in that table. Now, which is a protective serum, a tetanus antitoxin, it came in between. It is more than 0.01. Now, go ahead and answer this question. Hello, Majida, can you read it? Can you read it?
Which of the following is not a component typically found in acellular pertussis vaccine? A. Pertussis toxin. B. Filamentous hemagglutinin. C. Live attenuated B. Pertussis bacteria. D. Pertactin. Not a component. Live attenuated.
Yeah, live and it is not. Okay, there's a straight answer. What's the next one?
A 12-year-old adolescent who received a full primary series and boosters of wholesale pertussis as a child is due for a tetanus booster. Which vaccine should be given? D. TAP. D.
Lazima, it is TDAP. You see, you can't give
TDAP.
DTAP. You can give D, a full dose DT after 7 years. Therefore, you have to give TDAP. Remember that TDAP is advised at 10 years, even by the Indian Academy of Pediatrics, but they do not advise, they also advise every 10 years. Okay. WHO says it's only up to 10 years. As we have discussed this in full detail back in catch-up immunization. You don't attend, what can I do? Therefore, single dose TDAP may be used. Up to 7 years, you can give DTWP or DTAP. But after 7 years, you cannot give the full, not only the wholesale vaccine you cannot give the full dose of the diphtheria toxoid also. You will have to give the reduced dose of diphtheria toxoid, but you can give the full dose of tetanus. That's why you give TDAP. Okay? Pertussis vaccine. What's the next one?
A 3-month-old infant developed inconsolable crying for 4 hours after the first dose of wholesale pertussis vaccine. What is the recommendation for the second dose? Administer the next dose. This is a precaution, not a
Yeah, I think the question is
contraindication.
the repeat anyway. Now you can read what is given in the bracket.
Events such as persistent inconsolable crying more than 3 hours, duration or hyperpyrexia, fever more than 40.5 degrees Celsius, or hyporesponsive event within 48 hours of wholesale pertussis administration, seizures with or without fever within 72 hours of administration of.
Okay, read it. I can't hear. Can anybody else read? Hello? There's a break. Can you read it? Without fever symptoms are considered as precaution but not contraindication for future uses. Gopika, can you read it? Can't hear.
Events such as persistent inconsolable cry for more than 3 hours duration or hyperpyrexia, that is fever more than 40.5 degrees Celsius, or HHE within 48 hours of DTP administration, seizure with or without fever within 72 hours of administration of DTP, are considered as a precautions, but not contraindications to future doses of DTP, because these events generally do not reoccur with the next dose and they have not been proven to cause permanent sequelae.
Okay, therefore this we have this was the question before. Okay, it's a precaution only. Therefore, it's a precaution. Now, read the next question.
According to IAP, what is the primary reason for recommending early completion of the primary pertussis immunization series? To reduce the number of clinical visits, because maternal antibodies provide no protection against pertussis, to allow for earlier administration of the MMR vaccine to reduce the risk of vaccine-associated encephalopathy.
Anybody? Gopika, if you want to answer, Faris, you want to answer, anybody can answer this question. It's a good question. Gopika, you are there or not?
So,
Gone.
protection against pertussis. B, sir.
Yeah, you're right, I think. Yeah. But read it.
Answer B, because maternal antibody provides no protection against pertussis. Early completion of primary immunization is desirable as there is no maternal antibody for protection against pertussis. This marks infants
This
highly
makes infants
vulnerable.
highly vulnerable from birth. Remember this, among the vaccines, you the most worried about is pertussis, because diphtheria doesn't occur before 6 weeks in a newborn baby. Tetanus, mothers receive tetanus even now. They may not receive Tdap. Therefore, if the mother is not protected by Tdap, it's not given Tdap to the mother, only given TD, it is unlikely that the child will develop tetanus or diphtheria, but are at risk for whooping cough. And a whooping cough in the newborn period, high mortality and morbidity even in the West. Okay, the answer is given in this. Recommend early completion of primary immunization is desirable, and there's no maternal antibody for protection against pertussis. Remember, pertussis has got some funny things. There is no transplacental immunity. Number one, it can occur from birth to death. Even a 70 or 80-year-old person can develop pertussis. It is more frequent, it's more serious in females than males, and produces a lymphocytic response and not a neutrophilic response to an infection. These are certain peculiar things about the pertussis infection. Now, how do you prevent a newborn? You read what is given in the bracket, please. This WHO question paper. Yeah.
Although a booster dose in adolescents has been shown to decrease disease in adolescents, this is not generally recommended as a means of controlling disease in infants. A decision to introduce an adolescent and or adult booster dose should be taken after careful assessment of local epidemiology, contribution of adolescents as a source of infection in young infants, target groups, incidence, and cost effectiveness data.
Okay, they say that we want to give boosters Tdap. Tdap is advised at 10 years, even by the IAP, and it's sentinel. Every 10 years, it is advising. Well, WHO says after 10 years to give, there is no evidence of benefit. But IAP would say that it's better to prevent it in adults and mothers so that the child doesn't get affected. But what they say is shown to decrease in adults and but not recommended controlling disease in infants. If you want to control the disease in infants, you have to give Tdap at least one dose to the mother, to pregnant mother, not just this. Adolescent immunization has not shown to prevent infants, the newborn getting tetanus. That's what WHO states. Okay. Okay, go ahead.
Which of the following is a true statement regarding the duration of protection provided by pertussis vaccine? A. Immunity from AP vaccine lasts longer than WP vaccines. B. Immunity from natural infection is lifelong and superior to vaccination. C. Immunity from both WP and AP vaccine wanes over 6 to 12 years. A single booster dose in adolescent provides lifelong immunity.
Okay. What is it?
A single.
There is a statement telling that you read the answer now. I don't know why you are not able to answer. Yeah. Now, this is produced by, there's an article, this is produced by vaccine, which says immunity from both this journal recommendation, WP wanes over 6 to 12 years. But he also adds, confirms is noting more rapid waning with AP vaccine. This is a meta-analysis which we have said. Therefore, both of them, natural infection, WP vaccine and AP vaccine, the immunity does wane. Now, if you look at it very carefully here, we go back, but definitely duration of protection longer for whole cell vaccine and shorter for AP vaccine. Okay, remember that's what is given in the table. Okay. Immunity against all three components wanes over next 12 years, thus regular boosting is required. What do you mean by all three components is there are vaccine with multiple components and all of them wane over 6 to 12 years. Now read this. This is a study which a meta-analysis, I think, did we read it? No, this is 2021. Did we read this or did we not read it? I don't remember it. You can read it once more. Please read it fast.
We conducted a systematic review of VE and duration of protection studies for the wholesale pertussis and acellular pertussis vaccine and conducted a formal meta-analysis using random effects models. Evidence continues to suggest that receipt of any pertussis vaccine confers protection in the short term against disease, although this protection wanes rapidly for AP vaccine. This is first systematic review and meta-analysis to explore the impact of multiple sources of heterogeneity on pertussis vaccine effectiveness estimates through extensive subgroup analysis. Even with high heterogeneity, the findings from our analysis were consistent with those from previous SRMAs, showing high protection following any pertussis vaccine with declining APV over time.
We had read this earlier. Sorry. In England and Wales, also increased incidence was noted in infants less than 3 months. Data from US suggests waning of immunity. Why did they develop below 3 months? Because the mothers got infected. Okay, now leave it. Now if you read this, recent outbreaks, you can read it, what is given here.
Sir, we have read this.
Yeah, I've read this. Okay. Now, this also we have read. Okay. Mohsen, you are there, no? Mohsen is silent. Mohsen, I can see you are logged in. Can you read it?
Yes, sir.
Mohsen, you are there?
Yes, sir.
Why you kept quiet so long? Yeah, now you read it.
A child recovering from a confirmed case of pertussis should still be vaccinated because
Quick.
natural disease does not offer complete or long-lasting protection.
Yeah, now my question to you is the answer is same. A natural disease does not, it is essential to immunize even recurring pertussis. Natural disease does not confer. It is essential to immunize children, even those recovering from pertussis, as natural disease does not confer protection. May I ask you a question? If a patient has a typhoid, do you have to vaccinate him when you send him home? Quick. If you have a child with typhoid and he's being discharged, should you give typhoid vaccination? Advise typhoid vaccination? Mohsen, you answered it. Yes or no? Gopika, you are there or you have gone? Gopika is gone, I think. Just keep it. Lasima, what do you answer? Well, I can teach immunization the whole year and still you will not answer very practical questions. If the typhoid is being discharged, should you give the typhoid vaccination? Advise typhoid vaccination? Definitely yes. Pertussis, definitely
Yes.
yes. Tetanus, you have a tetanus, you are discharging. Will you give tetanus vaccine? Yes or no?
Yes.
Definitely yes. What about diphtheria? When you're discharging a patient with diphtheria, will you give the vaccination? Definitely yes, because it's diphtheria toxoid and it's better. You may have to give it. Pertussis, yes. You are discharging a known case of measles. Is measles immunization required? Probably no, because measles disease usually produces lifelong immunity. It is more immunogenic than any vaccine available. So these are fundamental immunology. Anyway, okay, go ahead with it. Okay. Mohsen, read it.
Which organization data cited in the IAP document found that true resurgence of pertussis occurred in 4 countries using acellular pertussis vaccines and one using WP, whole cell pertussis.
Is a true resurgence in AP vaccine. Yeah.
WHO.
Yeah, WHO. That's a WHO. True resurgence was seen only in 5 countries, and that's given here. The WHO analyzed epidemiology from 19 countries with high prevalence coverage, and true resurgence was seen only in 5 countries using AP vaccine and one using WP vaccine. Okay, go ahead.
For an 11-year-old who received DTaP at age 7 as a part of catch-up series, what is the IAP recommendation for further vaccination? For 11 years.
For further vaccination, 11-year-old child has come to you.
Received DTaP at 7. Then can be given DT every 5 years. TD every 5 years.
No, nobody advises TD every 5 years. TDAP is advised every 10 years. This is TDAP at age 11 to 12 years. I already said adolescent dose is advised, not given in the government, advised in the by IAP. IAP not only advises is 11 and 12 years, it advises every 10 years decennial. It is written. WHO advises at 10 years, 11 to 12 years, but does not advise beyond that. Okay, this is what you should know. Therefore, when your child comes, TDAP, definitely IAP. WHO up to 10 years. And universal immunization program, I don't think there's a TDAP at 10 years. Okay. Okay, read this. Read the answer.
Administer another dose of TDAP at age 11 to 12 years.
Okay. Read the reference.
The guideline states for person aged 7 to 10 years who receive a dose of TDAP as a part of catch-up series, an adolescent TDAP vaccine dose should be administered at age 11 to 12 years.
All right.
What is the IAP stance on superiority of IAP vaccine with different numbers of components? Example, 2 components versus 5 components. A vaccine with more components are always superior. B, there is no evidence of superiority for any AP vaccine based on the number of components. Only monocomponent vaccines are effective. 5 component vaccines are required for use in India.
Competent means that the different vaccines are different effect. Even today, I got the WhatsApp from the Glaxo telling that their vaccine, Infantrix, contains Pertactin, and that is very, very superior to all other vaccine because its antibody is required. But the WHO, there is no superiority of any AP vaccine based on the number of components, even monocomponent or multi-component. It is the same AP vaccines. The in between is same. You can read it in the okay, read what is given in the bracket.
These vaccines contain more than equal to 1 of the separately purified antigen pertussis toxins, filamentous hemagglutinin, pertactin, and fimbrial hemoglobins 1, 2, and 3. Vaccines differ from one another not only in the number and quantity of antigen components, but also with regard to the bacterial clone used for primary antigen production, methods of purification and detoxification, incorporated adjuvants, and the use of preservatives such as thiomersal.
This is what they will, the companies will try to come and say, we have Pertactin, we have Imagron. They don't have like that. But that is not what is given. Okay.
There is considerable controversy on relative efficacy of different AP vaccines with varying number of components.
Now here, several randomized controlled trials to continue. Anyway, there is but controversy, but IAP states that it is not so. Okay. Now individual use the comparison. Use it.
Indian Academy of Pediatrics has issued following recommendation on use of pertussis vaccine for office practice in private health sector. Primary immunization. The primary series should be completed with 3 doses of either WP or AP vaccines, irrespective of the number of components.
Therefore, we are now
The schedule
only on the components. We leave it. That the rest we will not read it now. Therefore, whatever be the number of components, we don't mind. There's no evidence superiority of any APA vaccine based on the number of components. Immunity against all 3 components wanes over 6 to 10 years, and therefore all of them regular boosting. Current generation of API available from different manufacturers should be considered as different and unique products because of the presence of one or more different components in different concentration and with different degree of absorption to different adjuvants. Even then, the studies which have been done, meta-analysis which have been done by multiple vaccine has almost shown the same results. Okay. Can you read it, Mohsin?
Which of the following is a common minor adverse reaction reported in nearly half of infants after a DTWP dose? Fever and local site pain.
Yeah, you must be. When people come and complain of fever and local site pain, you say 50% develop it with DTP. There's nothing to worry. Pain, swelling, redness at the site, fussiness, anorexia, and vomiting. Minor side effects, and half the patients will develop it. Now read it. Now the most important thing, see, fussiness in almost half. We have read it. You have to remember that the frequency of systemic reaction reduces and that of local reaction increase with increasing number of doses. But to say that for booster doses you will give DTAP is ridiculous because only the local reaction increases. The systemic reaction actually becomes less as you give the booster dose. Now, again, I'm coming back into the adverse effect to show you. Again, I want to stress on you that the minor side effect, 1 episode in 2 to 10, equal to control. Definitely it scores. Serious side effect, both are rare at par with WP vaccine. Don't forget this. Anybody telling anything else, tell them that the serious side effects are same. But these people in the few lines ago, they said that you can reduce it by 2/3 by switching from acellular vaccine to whole cell vaccine. This is a problem with the immunization book, but this is what is given in most of the CDC and all other guidelines, okay, with WHO, etc. And because of the side effect, I don't think you should give boosters with by acellular vaccine, and there is no reason to give AP vaccine just because of parental anxiety. You can always counsel them properly. Okay.
According to IAP, which vaccine should be used for individuals aged 7 years and older? TDAP.
Okay, we have already answered this. Okay. Okay, now next. It's not recommended for children. Okay, now
It must also be remember.
Read the next question. There's nothing much in that. Okay.
A study by Witt et al. Cited in the IAP document concluded that AP vaccines are more effective than WP vaccines. A vaccine series containing at least one dose of WP is more effective and durable than a wholly AP series. Natural infection is more protective than any vaccine. Booster doses are not necessary after age 5. B.
B, huh? Yeah, that's by saying at least one dose is more effective. Wholly AP vaccine was significantly less effective, wholly AP vaccine, than one that contains at least one dose of the traditional whole cell vaccine. And remember, this is the series which we are giving. This is the vaccine which we are giving in our hospital. And what is this called? What is the effect called of the single dose of whole cell vaccine? That's called priming. I told you this, priming. You see, this is priming. Definitely whole cell vaccine superior. The first dose, whole cell vaccine, priming superior because it produces. This is inferior. Black and white or green and red. Durational protection longer, shorter because of this. But read what is given in the bracket.
These findings suggest that priming with WP is more effective at sustained prevention of pertussis disease than AP vaccine. Witt and colleagues, after reviewing data from Kaiser Permanente, North California, conclude that a wholly AP vaccine series was significantly less effective and durable than one that contains at least one dose of the traditional whole cell vaccine.
Okay. Now this we have already seen. We have seen that this. What is this reason? Because whole cell vaccine stimulates Th1 and Th17, and which is interleukin-2, and that is more for intracellular organism. And Th17 is very useful for mucosal immunity. Therefore, herd immunity is better. While the acellular vaccine T2, which is not that good in immunologically, is inferior. That we'll not go back into that. Now again,
Which
repeat
immunological
it. So, yeah,
findings? Which immunological
yeah.
finding is associated with individuals who were primed with AP vaccines compared to those primed with WP vaccines? T70.
See,
Stronger
Th1 and
T-cells.
Th17 are by whole cell vaccine. Therefore, A and C goes away. Now, elevated pertussis G4 antibodies are more with AP vaccine. That's what it is. Th2 cytokine. Ch2 cytokine is actually producing Ig4 antibodies. The document state pertussis specific Ig4 antibodies were significantly elevated in AP compared with WP. Ig4 antibodies less effective in neutralization and more tolerizing in nature. Remember what is given here. We have read this already. That is, if you give, can you read what is given in the bracket? It is repetition, but still read it.
Adults who received a Tdap booster and who had received either WP or AP priming, followed by multiple AP boosters, the AP prime group showed increased interleukin 4, interleukin 5, IL-13, 9, and transforming growth factor beta, and decreased interferon gamma and interleukin 17 production, effective in their ex vivo capacity to expand memory cells and less capable of proliferating in vitro. Pertussis-specific IgG4 antibodies were significantly elevated in AP compared with WP individuals. While IgG1 antibodies are potent neutralizing antibodies, IgG4 antibodies are less effective in neutralization and are more tolerating in nature. Tolerizing in nature.
Black and white, it is in the IAP purple book also, the basic immunology by which the whole cell vaccine is superior to acellular vaccine. I have no doubt about it. That's why priming, again, I put up the same durational protection. And in India, okay,
In India, for a child, the private sector who experienced a hypotonic hyposensitive episode after a DTWP dose, what is the IAP recommendation for future doses if resources permit? AP vaccines may be preferred.
yeah, but it is not something which is very black and white, but you may be right because See, this is what Rose is there. Rose is not come today, I think. Okay. Only 5 people, and I don't think Rose is there. No, Rose is not come today. My question to you is recommendation for future doses. Hypotonic hyporesponsive episode. How do you differentiate it from anaphylaxis? Anaphylaxis is the contraindication. Hypertonic hyporesponsive, you will not find much discussed. Now, since there's a lack of time, there's only time I might just rush through, but you must be able to say, how do you differentiate? I've asked this question several times in the previous. You give an injection to a child, suddenly becomes hypotonic, not responsive. If you label it as anaphylaxis class, that means lifelong, he can't receive any of the competent vaccines you gave. But if you diagnose as hypertonic, hyporesponsive episode, you can definitely vasovagal syncope. The patient is supposed to come back very fast. You put him down, raise his legs, probably he will within 15 seconds to 1 minute, he will regain his consciousness and become all right. Must not be allowed to sit down or may raise up. But the other important thing is hypertonic, hyporesponsive episode. You gave an injection, the patient became hypertonic, he's not responding, you call him, and he's not responding, the mothers and the nurses are yelling, and you're called nearby. How do you know whether it is an anaphylaxis or a hypertonic, hyporesponsive episode? Mohsen, what do you say? Gopika, you're there? You're gone forever? I can see you are. See, this is what happens. People log in and then they go in without somebody else has joined. Who's that?
Anju ആണ് sir.
Anju, okay. ഈ hypertonic hyperresponsive കണ്ടിട്ടുണ്ടോ Anju? Have you seen it? No.
ഇല്ല sir, yet to see, but sir ഇല്ല കണ്ടിട്ടില്ല, ഇതുവരെ കണ്ടിട്ടില്ല.
Okay, therefore, this is a very important thing, that when you give an injection and the patient many times, the Rose actually asked me about last time. She said somebody else in Calicut in the periphery, they were given vaccine by the A&M. According to history, nothing is recorded. The patient was not responding. The eyes went up. And after some time, though she doesn't know the exact time, the patient came back to normal. Now, this is given in the wholesale vaccine. And can you vaccinate him? How do we know whether it is hypertonic? Most probably it is hypertonic, hyporesponsive, whether it is anaphylaxis. Actually, anaphylaxis also can be transient. It is not very well discussed anywhere. Remember, if you prescribe it as hypertonic, hyporesponsive episode, there's no contraindication because it usually does not come back. But definitely the HHA is more common in wholesale vaccine rather than acellular vaccine. And after the introduction of acellular vaccine in Western world, HHA has become very, very rare. But nowhere it is written that if you are HHA, you should give acellular vaccine next time. But it's better to give acellular vaccine. Now, when I read through it, I went into a literature. Everywhere I look, the only thing you can say is in hypertonic, hyporesponsive episode, there's no hypotension. While in anaphylaxis, there can be. Therefore, if there is hypotension, then definitely it will become an anaphylaxis. Remember this. But maybe your examiner may not know it. But it is very important to differentiate practically. Therefore, AP vaccine may be preferred. That's the right answer to it, actually. Go ahead. May be preferred. Can you read what is given here? Individual use IAP recommendation.
However, the AP vaccines may be preferred to WP vaccines in those children with history of severe adverse effects after previous days or of WP vaccines, children with progressive neurological disorders, if resource permit.
Now, the IAP purple books make sweeping statements like this without any evidence. Now, this may be okay, may be preferred. I agree with that. You may also prefer it. But children with progressive neurological disorders, if it is, you're not giving, there is you better not give any pertussis vaccine, because for the simple reason that the people will blame the vaccine for the progression of the neurological disorders. You don't want, there's no evidence that in a neurological disorder, in infantile syndrome or West syndrome, the whole cell vaccine or the acellular vaccine increases the problems. But you don't want the vaccine to fall in disrepute. That is why you don't give it. But here, they have said that in children with progressive neurological disorders, if actually in stable neurological conditions only, pertussis vaccine is given. Probably in progressive neurological disorders, it might be better to give TD and not. But from where they gave this statement, I'm not too sure. Okay, read what is given in the this one. I think we read it. Leave it now. We read it. We leave it now. This also we have read it, isn't it? See, the thing is that for patients with the history of encephalopathy following vaccination, any pertussis vaccine is contraindicated, and only diphtheria and tetanus vaccine may be used. DTP may safely used in stable neurological condition. Progressive or evolving neurological illness are a relative contraindication to the first dose of DTP vaccine immunization. A relative contraindication. That means once the progression is over and the diagnosis is made, probably you can give DTP immunization. Yes, you might prefer to give DTP, but there's no encouragement for that. Therefore, to this answer, yes, HSP definitely you might give, it may be preferred. Okay, that may be fine. If they had written whole cell vaccine is contraindicated, I would have protested. Therefore, in multiple choice, you should read the questions very carefully. Okay, go ahead with it. Only two more questions.
What is IAP's recommendation for pertussis vaccination in HIV positive infants? Immunization.
Okay, read.
All infants, including those who are HIV positive, should
be. That is, the document explicitly says that all infants, including those who are human HIV positive, should be immunized in infancy. Not later on. Later on, you will have to look at the CD4 count, because generally newborn in infants, the CD4 count will not be low. This aligns with WHO and CD guidance for inactivated vaccine, because you want to vaccinate early and not postpone it. Later on, when the CD4 count drops, you may find the vaccination may not be effective. And this given in individual use, all infants, including those who are HIV positive, should be immunized against pertussis. Okay.
According to 2021 systematic review and meta-analysis by Wilkinson et al., cited in document, what is the key finding regarding acellular pertussis vaccine effectiveness?
What is it?
Protection from AP vaccines wanes rapidly over time.
Yeah, that's right. We have already asked this question, it seems. Evidence this is, Anju, this is a systemic review in 2021 and meta-analysis. They continue to say that
Yes.
Evidence suggests that receipt any pertussis vaccine confers protection short-term against disease. Short-term protection is equal, wanes more rapidly for AP vaccine. And they have also written declining AP vaccine over time. Vaccine effectiveness is more with AP vaccine than with WP vaccine. This is a relatively new one, 2021, meta-analysis and systemic review. Now, we have shown this again and again. Duration of protection is definitely lower in whole cell vaccine, and the priming is definitely superior in whole cell vaccine. Only thing is minor side effects are more common. Reactogenicity, they are telling, but serious side effects are equivalent in both. These are important things. Can you read it? Yes, Mohsen.
What is the primary carry-home message from IAP document regarding the comparison of WP and AP vaccines?
1 minute.
So
Hold on
it's
1
keywords.
minute. Sorry, continue now.
Answers given. WP vaccines have more efficacy and definitely longer duration of protection than AP vaccines.
Okay, that's the final carry home message section. I'll go through this edit. Now, what is the choice of vaccine is one of the main reasons why I put it out. Not only from the examination point of view, from a practical point of view also. And you should know exactly what the organization says. The IAP Purple Book is very good, but definitely it gives the opposite things in different pages as which you have seen. And that is very, very what you call troubling. And the most of the people who come and give in IAP webinars, we will come into that. Now, look at what is the WHO position choice of vaccine in the public sector. Read it first.
Protection against severe pertussis in infants and early childhood can be obtained with primary series of either WP or AP vaccine. Available evidence indicates that there is more rapid waning of immunity and possibly a reduced impact on transmission with AP relative to WP vaccine. When considering a switch from WP to AP vaccines for a primary series, the overall goal of the program needs to be considered. A switch from WP to AP for primary infant immunization should only be considered if the additional periodic boosters or maternal immunization can be assured. National programs currently using AP vaccines may continue, but should consider the need for additional booster doses. National program currently administering WP vaccine should continue with WP.
If you read in between, they are very clear. The WP vaccine, if you continue using it in public health. If you are using AP vaccine, may continue, but you should consider booster doses. Therefore, they are very clear that the waning of immunity is a major factor. Okay. Now they say that you can give either WP or AP vaccine, the primary series. Immediate protection is good, but long-term protection is not good. Now what they said in immunization book in 2018, you read it.
There is scarcity of data on vaccine efficacies for both WP and AP vaccines in India and other developing countries. Continuous decline in reported pertussis case in last few decades that have demonstrated good effectiveness of WP vaccine of whatever quality in India. Indian Academy of Pediatrics has now issued following recommendation on use of pertussis vaccines for office practice in private health sector. The primary infant series should ideally be completed with 3 doses of WP vaccines.
You see, in 2018-19, this categorical statement was given. Okay, even in private practice, you should give wholesale vaccine. When it came to 2022 in the Purple Book, that statement is not there. They say you can complete it with either WP or AP vaccine. In spite of the fact that they say WP vaccine is more effective, has long-lasting immunity, but is more having a reactogenicity. But they say that in India, the parents accept it very well. Therefore, why they kept it away? I think there's a lot of pressure from the more costly acellular vaccine. Now, this is a webinar in 2020. Anju, you are there? Anju has
Yes, sir. Yes, sir. Yes, sir.
See, it's very interesting to
Yes, sir. I'm here. I'm here only.
Yeah. In 2020, an hexavalent has vehemently stated, you see, these are people running in from Bombay and state, there's nothing wrong in AP vaccine. The recent surgence of pertussis in the West has nothing to do with AP vaccine. Pediatrics, WHO, IAP categorically states that this is because of the shorter lasting protection of the AP vaccine. Pediatrics is the journal of the American Academy of Pediatrics. And it says maybe multiple factors are involved, But the most critical one is the shorter acting. And they come and state in front of the whole national that there's nothing wrong in AP. Now here, what is written here is from the other findings highlight the need to develop new pertussis containing developed long-lasting immunity. Already you had WP vaccine, I don't know. None of the developed countries still using AP vaccine has revert to AP vaccine. This is what the people will say. Why have the Western countries, Australia, UK, in spite of the resurgence of the pertussis, don't go back into the wholesale vaccine? And now that is given. Industrialized countries would not take the risk of reverting to WP vaccine, considering the low acceptance of these vaccines by the public in the past. Acceptability of WP vaccine has not been a problem in developing countries like India. Therefore, there's a very high reason to give wholesale vaccine even in the private sector in our country, because it's well accepted, superior. And the only reason you can't say the Western countries are giving AP, therefore that's better. What happened is they went on advertising that the acellular vaccine is less reactogenic, less pain, less reactions. And now to revert back to wholesale vaccine will be impossible there. More than that, the WHO portion on pertussis states protection against severe pertussis in infants and early childhood can be obtained. This is a problem. Even WHO, after giving all the advices of superiority of wholesale vaccine, finally says you can give either primary series of WP or AP vaccine, when it definitely gives less longer immunity. Why does it state that? Available evidence indicates that there is rapid waning of immunity and possibly a reduced impact on transmission with AP related to vaccine, because there's no herd immunity. This causes epidemics. Further states that the national program recently using AP vaccine may continue, but should consider the need for additional booster doses. A national program currently administering wholesale vaccine should continue with wholesale. That, in other words, means that if you are giving AP vaccine, you should be giving the TDAP every 10 years, as is advised by the IAP. AP vaccine, okay. These we have read. Evaluation data from large pertussis outbreak in California, okay, showed that protection from disease after a fifth dose of DTaP among children who had received only DTaP vaccine relatively short-lived and waned substantially each year. This is from New England Journal in 2012. Therefore, it is not the our vaccines alone. The all international journals also have come to the agreement that it is short-lived, the AP vaccine. But why they advise it is because they are not able to revert back into the other one. Now, this is New England Journal, where article also stating this. Now, in 2020, 2020, I had put up a choice of pertussis vaccine. Is this acellular vaccine or wholesale vaccine? It's a very important thing in your private practice. And it was a 30-minute video on the basis of the evidence available there. The same evidence is available. I have extensively quoted from IAP Pink Book, which is 2018-20. 2020 also, the 22 also is almost similar, except that they don't say that for unequivocally we advise wholesale vaccine in private practice. That statement is deleted from the Purple Book. Therefore, I will stop sharing a book here, and I'll stop the recording also.